glad because my special guest is Dr. Ira Gordon. He's a veterinarian, he's a radiation oncology specialist, he's a cancer researcher, he's an entrepreneur, and during his time he did a fair amount of teaching as well. But Ira, welcome to the show again. It's your second time on, and thanks for reappearing.
Yeah, I'm thrilled to be back. Thank you very much for having me.
Today you want to talk about a different type of therapy using radiation, which I think is awesome. It's anti-inflammatory radiation therapy, and I think that's really good because you've had some positive initial results, correct?
Absolutely, and this is something really interesting that's been going on for much longer in Germany and throughout Europe than it has been in the States for people and for animals. And it turns out that low-dose radiation, which is very different than the high doses that we typically use when we treat cancer, can have very strong anti-inflammatory properties. And there's a lot of research that shows how this might work and how it can influence the what we call cytokines, which are the mediators that sort of impact the inflammatory response in the body with low-dose radiation. And the impact that low-dose radiation treatments can have at decreasing inflammation. So the most common inflammatory disease that we see in older pets that can be a major source of decline in their function and quality of life is arthritis. And it turns out that low-dose radiation can be certainly not the only treatment for arthritis, but an effective complement to other therapies or alternative to other therapies. I think what's really interesting in people is in Germany, it's actually quite common for people to receive low-dose radiation for arthritis. And there are studies of thousands of people that receive these therapies and have quite high rates of improvement and response, and oftentimes for quite some time, years. And so we've started doing this in some of our animal patients, both dogs and cats. Dogs because as they get older, arthritis is extraordinarily common, and the drugs that we use can be effective, but not all dogs can tolerate them well, and for some dogs, they're just not enough to manage their pain and inflammation associated with arthritis.
Well, let's talk about that a little bit. But how do you get over that hump? I can just picture myself in an exam room going, okay, we're going to do some joint supplements, we're going to do some anti-inflammatory pain management, and I'd like to send you to Dr. Gordon so you get radiation dose. So for our listening audience, can you explain, what is there a comparative model to the amount of radiation the low dose gives you, and how do you start that conversation with clients?
Yeah, I think it's usually not going to be the first treatment that someone reaches for an animal that's initially diagnosed with arthritis. But as arthritis progresses over time and animals continue to struggle despite sort of routine medical management, it can become a really appealing alternative. And in terms of the amount of radiation that we use, it's typically less than 10% of the type of dose that we would give to a patient being treated for a tumor. And so we expect to see, really expect to see no side effects from the radiation itself. In about 2 to 3% of animals, you might see a little bit of a change in the hair color at the radiation site, but that's really it in terms of side effects. And really, I think the biggest hesitation or hang-up that people have when we think about using radiation to treat a benign disease is, what are the dangers of radiation? And probably the most common danger that people worry about is, can radiation cause a cancer? And there's no doubt that it is established that radiation exposures can be associated with increased incidences of cancer, but there's a lot of research that looks at low-dose exposures and finds that while if you're a very young person or young dog, that there is a not negligible risk of increased cancer incidence after those exposures, that for people that are over 50 or 60 years of age, and presumably for dogs that are over 6 or 7 years of age, that those risks are well under 1% and probably under significantly lower than that. And if we can have a treatment that's going to significantly improve a pet's quality of life at those very, very low risks of that type of damage, it's certainly something that we think is worth considering.
And it's funny because when you were talking, my mother, she's around 85. She told me that when she was young, she used to go to the department store and they stood on this device, and it was X-rays that would show their feet so they could measure their feet size. How many doses are required? And then how long does this therapy last for?
So really interesting that you mentioned your mother's exposure to low-dose X-rays to her feet when she was a child, because that's actually one of the things that are used to calculate the actual risk of cancer from low-dose radiation exposures. And as you mentioned, a bigger concern for young people, which, back in the day, it was young people that really had this done more routinely. In terms of the number of treatments that are done, the way I typically do it is with a 3-treatment course where we treat them either on consecutive days or every other day. There are protocols that just do a single treatment as well and seem to be effective. We expect about 80% of dogs to improve with that initial course of treatment. The ones that don't respond can be retreated because it's low enough dose that they won't get side effects from more treatment, and we can move that number to probably a little bit above 90% for the dogs or cats that might be treated twice. The duration of that response can vary quite significantly. I'd say the typical range would be between about 4 and 14 months, but an average of about 8.
Wow. Okay, that is great long-term therapy. How did this whole concept of the low dosing being anti-inflammatory, what sort of quirk or what's incidental finding occurred that led to this?
Actually, really interesting example that maybe gets to your question is a colleague that had done radiation therapy for a cat that had an oral tumor, but also had a long history of a very common disease of oral cats called stomatitis,
Yes.
Which is inflammation of the gums that can be treated with, very difficult to treat, but can sometimes requires extraction of many or all of their teeth and steroid therapy and a variety of other things. And it was sort of interesting that she said, the tumor that she treated didn't really respond that well, but the cat's stomatitis improved to levels that it had never improved to with all the other medical therapies that it had gotten. So it was a pretty interesting example of how radiation could work to modulate that inflammatory response in a cat with sort of a long-term inflammatory disease.
That's great, regardless of what method we use. I use a lot of laser therapy, and even that will not keep that stomatitis at bay. And inevitably, having the discussion with the client, saying, we have to take all of your cat's teeth out. It's a real shocker. It's not the greatest thing to do from a medical standpoint as well. But that's great, and that leads me to this question: is so what is the future of this?
I can't predict the future, but I think that the concerns with that would be that although these are relatively low doses, somebody has to administer these doses, and so. Typically for me and for my staff, we will briefly anesthetize our patients to deliver these treatments in a room that we have to step outside of so that it can be done safely. Could that be done potentially with a machine that's not as intricate and expensive as the machines that we use for cancer therapy? I think that definitely could be the case. These are some of the easiest treatments that I do because we don't need to worry nearly as much about protecting the normal tissues right near the targets that we're treating. So I think there is some opportunity there for some more readily available technology to address that need.
Is this something that every referral center that has cancer radiation therapy equipment can perform this sort of procedure?
I think that I'm one of the few people that really sort of seek out cases for this therapy, but the technology and availability of this should be available anywhere that does radiation therapy. But since there are only a handful of research studies in dogs and cats that discuss it, finding somebody that's sort of interested enough to look into those or contact people to figure out exactly how to dose it and how to do it in a way that is likely to be safe and effective should be all that's really needed.
Well, I know I'm going to start talking to my clients about this. That's great. That's great new technology.